My name is Justin Toe. I'm the Associate Chair for Gynecology at Maimonides Medical Center, and I'm also the Program Director for our Fellowship in Minimally Invasive GYN Surgery. Typically, patients come to see me for multiple issues, for example, fibroids, polyps, cysts, symptoms that they may have, pelvic pain, abnormal bleeding, whether that means they're having too much or too little bleeding, for example. Also, patients come to me for infertility and initial workup of that and initial treatment for infertility. We provide the full gamut of gynecologic procedures and gynecologic care. My philosophy of care is really looking at the patient in front of you and considering them as part of your family. In that way, you know that you're going to take the best care for that patient, you're going to go that extra mile for that patient, and you're going to make sure that that patient really understands their treatment and then is comfortable with whatever decision that you make together. Minimally invasive gynecologic surgery is a range of techniques that we use during surgery in order to improve patient outcomes. The benefits of minimally invasive GYN surgery are multifold. Number one, with smaller incisions typically, or sometimes no incisions, you have a much faster return to normal daily activity. For example, you don't need to be in the hospital most of the time. You can get back to doing your exercise and doing your typical daily routines. Additionally, there's typically a decrease in infection rates. There's also better visualization during the surgery, so that's better for the surgeon so that they can more safely perform the surgery. Also, blood loss tends to be less as well. We're one of the largest departments for minimally invasive surgery in Brooklyn. Additionally, we have the most robots and excellent technology and cutting-edge technology at Maimonides Medical Center. Our approach to women's health is to be the comprehensive center for a patient in any stage of her life. We're here to be a patient's one-stop shop, ideally, in Brooklyn for her care. In terms of my background, I grew up in Westchester, so upstate to some New Yorkers and not to other New Yorkers. Always dreamed of living in the city and working in the city, so I'm very happy to be living in the city and be working in Brooklyn now. I went to SUNY Stony Brook for medical school. Went to the Bronx and Montefiore/Albert Einstein College of Medicine for my OBGYN training. I stayed there for my minimally invasive GYN surgery fellowship. And then after that, I stayed for 7 years as faculty and had multiple roles in education as well as clinical roles. After that, I went to Flushing Hospital. I was there as a residency program director for 5 years. And then in 2022, I came to Maimonides. The diversity of Maimonides Medical Center and Brooklyn in general, I think, is extremely important. Myself, being a minority and from a Chinese background, I think that's really important. There is a large Chinese community here that I wanted to be able to give back to directly. Myself, I also speak multiple languages, so I wanted to be able to help those in the community that wanted to speak in their native tongue and still be able to get excellent care at Maimonides.